Next, I'm going to review the risk of red meat in breast cancer, since breast cancer is the second most common cause of cancer death in the United States.
Let's start by analyzing this meta-analysis from 2002. It pooled 8 prospective cohort trials together into a larger database totaling more than 350,000 women. Many of the studies in this group are the same studies we reviewed for colon cancer. The analysis of these studies showed no significant association between red meat consumption and breast cancer risk. But because red meat creates carcinogens when barbecued that we previously discussed, the heterocyclic amines in particular, researchers conducted this study in New York women that was published in 2007. It focused on women that ate a lot of grilled, barbecued, or smoked red meats, and there was an increased risk of breast cancer in this population. In this study of about 50,000 women published in the British Journal of Cancer in 2009 suggested a trend toward increased risk of breast cancer with meat consumption. This large study spanned many countries in Europe and had more than 300,000 women. It revealed a trend toward increased risk of breast cancer with processed red meat consumption. Another large meta-analysis was done with more recent studies, again showing a trend toward increased risk.
So why are all these studies showing a suggestion that red meat causes breast cancer without clear evidence? A group of investigators hypothesized a hormonal impact.
They conducted this study that analyzed younger premenopausal women that developed breast cancer. The women that consumed a lot of red meat and had hormonally responsive breast cancer tumors, that is, their cancers had estrogen and progesterone receptors, had a 2 times greater risk for breast cancer than women that consumed little meat. Does it make sense that red meat would increase the risk of breast cancer in premenopausal women via a hormonal response? There is bench research that suggests animal proteins, for example red meat, increase IGF-1, insulin-like growth factor, and IGF-1 is believed to increase breast tumor production. It may be that through a hormonal effect, red meat consumption is more impactful in women earlier in life, before menopause, and at a younger age. Some suggest it may be even more concerning in very young women, or even teenage girls that are growing, but more research is needed in younger age ranges. So researchers then honed in on the premenopausal age range. The best study done to date on this topic was published in 2014. It is a continuation of the Nurses' Health Study from 1991, but it is focused on the premenopausal subjects. 90,000 women have now been followed for 20 years, and there is an increased risk of breast cancer associated with red meat consumption, and it is highly statistically significant.
If carcinogens from red meat cause colon cancer and breast cancer, then why wouldn't they cause other cancers as well? Well, they might.
There is limited data that red and processed meats cause cancer of the esophagus, lung, pancreas, endometrium, stomach, and prostate. I won't review that evidence here, though. Overall, there is significant evidence that red meat increases cancer risk.